Hello everyone, and good morning. Welcome to our launch event on the impact of the Covid-19 pandemic on approved mental health professionals and services in England. And that report has been authored by our BASW member, Steve Chamberlain, who is with us this morning, who will speak shortly about the compiling of the survey and report. I'd just like to reiterate what Ruth said about Maris Stratulus unfortunately not being able to join us this morning because of some Wi-Fi and internet issues. But Maris is very disappointed not to join us this morning, as she's been played a key role in developing this work within BASW. We have a stellar lineup of speakers this morning. Hopefully you have a copy of our flyer for this event in front of you. We have Steve Chamberlain, who's authored the report, as I mentioned before. Steve is a BASW member and member of our mental health group. We also have Mark Trewin from the Department of Health and Social Care and the Chief Social Worker's Office, who will give some views around the department's view on the report. We have Claire Barcham, who is chair of the BASW England Mental Health Group, who will also share her views. And finally, we have Melanie Brooks from the Association of Directors of Adult Social Services as well, to provide with some insights. And also we have Emad Lilo from the Ethnic Minority AMP Forum, who will tell us about the views of the report from that group as well. So without further ado, I'm going to hand over to the author of this report, and that's Steve Chamberlain. Steve, are you with us? Can you hear me okay?
Hello, I'm here.
Hi there, Steve. Okay, so I think we're just uploading your presentation now. I shall hand over to you, Steve. Thank you.
Thanks very much, Wayne. Just need to take control of the presentation, and so thanks. I've got 10 minutes, although Wayne only took 5, so hopefully we've got a bit of time to spare, not too far behind. It's a big report, quite a big report, and so I mean, I'm going to just be covering the main issues here. First of all, I'm aware, having just a quick look at the people that have arrived in the meeting today, I'm aware that a number of you will have submitted your comments, and completed the survey. And I think that first of all, I want to thank people for the incredible amount of work that was put into that. It was quite a big survey, invited people to not just to tick boxes, to make comments, and people spent a really significant length of time completing the survey and created the rich amount of material that we've got in the survey. It's not just a set of charts, but there's some real interesting material there. And in order to give it the respect that it deserves, I've included quite a lot of quotes in the report from people, just to sort of back up some of the comments that I made and the findings of the report. So, first of all, just to say, we did the survey in September and October. Those of you obviously who completed the survey will know that, and it was based on the 6-month period beforehand, the 3 months of the first lockdown, the big lockdown where, you know, right at the start of the pandemic, then roughly the 3 months of the raising of restrictions, the easing of restrictions over the summer. So, and looking at the impact on AMP services during those times, and obviously we've got new and ongoing stresses and strains to deal with new restrictions, but that's what this report has really been focusing on. These are the questions, broadly speaking. There was quite a lot of questions there, as I say. Some were tick boxes and some were comments where people made lots of comments about the first wave, number of referrals against the number of actual assessments undertaken when actual complete assessments were done, people were gone out and seen or not. Some of the service changes that happened during the first wave, including some improvements as well. It wasn't all bad news, to be honest. I think there's some interesting comments about that. staffing issues, PPE, obviously a major issue, continues to be a major issue, but it was really acute at the start of the pandemic. Any changes to support service users, remote technology, a very interesting point there, which continues to be a moot point for staff. AMP training and any other resource issues. So that was the broad themes that we were looking at during in the survey. And so the key the summary, I suppose, of the key findings really are these are the main things that we found. And some of you who contributed to this won't be surprised to see some of the information here. I don't think there were any huge shocks really, but I think it's really important to be able to get the information back from across the country, just to say that we got responses across England. It only applied to England, so I think that there's a good response there from people, and what we found was there was a increase. People were reporting an overall increase in the number of first-time requests for mental health act assessments over the period. It did vary. There was, some people said there was a drop early on, and then it increased. A number of people talked about ongoing increase after the restrictions, that the first lockdown was eased. The second bullet point, I think, is maybe the most striking bullet point of all, issue of all that came up. A real strong message across the country about the increase in first-time presentations, people that hadn't been previously known to mental health services. And as a side issue here, I think it's quite interesting that I'd heard from a different meeting from police, the police and crime commissioners, about a survey they'd done. They found a similar response. I haven't actually read their report, but I'd heard that there was a similar response from similar finding from them about increasing number of people that didn't have previous contacts with mental health services were presenting in crisis. I mean, I think one of the important things here is about, we all know that AMPs only see people in the most acute phase of a crisis and most acute distress. So there are very many people who were experiencing mental distress, deteriorating mental health, who didn't come to the notice AMP services. So I think it's quite an interesting indicator. If we are seeing an increase in first-time presentations, then that's probably a pretty good indicator that we are that will be a broader concern around the impact of the pandemic on people's mental health more broadly, even those people who don't get so acutely unwell that they need an AMP assessment or need a mental health act assessment and possible admission to hospital. We had an interesting little corroboration, I suppose, yesterday from an MP for Broxbourne. I think Sir Charles Walker commented in Parliament yesterday about the impact on mental health of the pandemic, and he mentioned about his own mental health, and his argument was about, you know, whether or not the current restrictions should continue. Now, I'm not going to enter into that argument, but I just think that it's an interesting, very interesting point about the fact that our information about people at the sharpest end of mental health crisis is a strong indicator that it will have affected a lot of people across the country, a very broad impact on people's mental health as well as physical health. The thing is about, in the first 3 months, a number of the community services, non-crisis community services, stopped visiting people. They only were seeing people via or contacting people by telephone or maybe video, and the impact of that, certainly the feel was that there was a significant impact in terms of people who, this was people already known to services, really, and that the reduction in the ability to oversee the people's the reduction of people to be monitored, and the likelihood of deterioration of people who are already well known to services. So not just about new presentations, but also people that are already receiving support. The reduction in that support, even if they were getting phone support, the potential impact of the loss of face-to-face contact. Another big thing that came up from a number of people was the increase in requests for to the AMP service for mental health assessments, which did not lead to a mental health act assessment, and that links to the next point here. Were AMP services, and not just AMHP service daytime, but out of hours services and crisis teams, were they fulfilling a function that's normally undertaken by 9 to 5 community services because they weren't going out to see people? There was certainly a feeling that a number of referrals from a significant number of people, respondents, that stuff was coming to AMHP services which weren't necessarily at the stage where they would normally need that level of consideration, and maybe AMP services were. I'll just carry on. The slides aren't crucial anyway. I suppose what's really important is that that it's possible that there was certainly a feeling that AMP services were taking over the ongoing monitoring of people who couldn't be seen elsewhere, and therefore there are a number of requests came which didn't really require that consideration which would normally be required. Just the other issue was, not surprisingly, services had to be restructured in terms of remote working, and that had a real impact. Obviously, that was happening in relation to the risk of infection. But I think what's really important is remembering, as most people on this call will be aware of, the particular high pressure, high risk environment that a mental health act assessment is, and also in receiving the information and triaging and doing the initial assessment. Very high degree of risk, and if people are working remotely, then it makes it much more difficult to have immediate support from your colleagues. Many services set up alternative methods of remote support, but I think that had an impact too. There were some positives around the remote working. Some agencies, some services found real benefit around having regular remote contact with ambulance services, with the bed manager, with police services, to almost have like sit reps, daily situation reports about how things were going. So, and people were talking about maybe continuing that after the pandemic, because they found that was a better way of interagency collaboration. So there's a positive element there. Video technology, that's a biggie, really. I think there was a debate very early on about that, and many of people will be aware that the NHS and DHSC brought out guidance in May about that. But it was very interesting in the survey that there was widespread ambivalence, I think is the best way of putting it, concern not just about the legal element, the legality of it, even though DHSC was saying in certain circumstances, in their opinion, a full assessment by video, an assessment by video could be legal if certain safeguards were met. People were concerned, A, about the legality, but B, very importantly, about the ethics and the professional appropriateness of undertaking a remote assessment for something as great as potential admission to hospital and removing somebody's liberty. I think there's a really important message coming there. And so one of the things that I was saying that needs to happen, there needs to be a really careful consideration in the future about this, because digital technology is not going to go away. It's only going to develop further even after the pandemic. So I think we need to really be thinking very carefully about that and having a real open discussion about the pros and cons of that. PPE, of course, that had to come up. I mean, most places had PPE at some level, but equally not dissimilar to many other services. That was hugely variable. It remains quite variable as far as I'm aware in terms of different services. Some services with greater links to the NHS, their NHS colleagues seem to have had some better availability, but that wasn't a general situation. I think certainly the question about safety and the health and the risk of infection of AMPs was a big one, particularly around AMPs from Black and minority ethnic backgrounds who statistically appear to be of greater risk of severe disease, and the older age group, because we all know it's pretty well documented that AMPs are generally older than the rest of the social work profession. I realise that not all AMPs are social workers, but that's the information we've got there of an older age group. So that vulnerability just adds to the stress and anxiety, I think, to a degree. Linked to the PPE was the debate about whether or how well you can communicate with people if you're wearing a mask. And that's one of the questions I was saying is, are there better ways of doing this? Maybe using a Perspex visor or a mask that is plastic, see-through plastic. I realise the jury is out around Perspex visors about whether they're safe enough or not. But I think we need to think very carefully, because there was some significant concerns about the ability to undertake a mental health assessment with somebody who's in acute distress when you're wearing a mask and PPE, and the difficulties that in communication that presents. And that links also to the debate about remote assessments as well. So there's quite a complex mixture there. Finally, I'm nearly got to finish my time. I had a little bit more time, luckily, but I wanted to separate out the chronic issues that have been around for years and years about Section 12 doctor availability, transportation to hospital, emergency service support. We all know those have been major issues for a very long time, but there were very clear indications that some of these were made even worse during the pandemic. And I would just stick on, Section 12 doctor availability, a lot of doctors were either isolating or had to go off work because of infection, or but were diverted to COVID duties, and that reduced following the easing of the first 3-month lockdown. I certainly hope the Mental Health Act review will look at general Section 12 doctor availability and duty of the NHS to provide them, but I won't go there. That's a slightly different issue. Maybe transportation to hospital is the biggest issue here. I'm aware it was reported that some ambulance services just stopped providing conveying support during the first lockdown, and a number of services had to go to private or NHS. Private ambulances were being called, and I just think there's a real need to consider nationally the need for a much more clear thinking about whether we need to use 999 paramedic ambulances with all the bells and whistles that they've got, because in my experience it's a very, very rare occasion where you need a paramedic. You need a skilled professional, you need a proper piece of vehicle, a proper vehicle that's got proper security and enough space. But do you need a 999 ambulance because there's such competition with people who are being in road traffic collisions and strokes and heart attacks? So finally, the last slide, just about the limitations. Of course, there are limitations on this. The survey was based on impressions. We all know that there's no national recording of AMHP activity. The only recording is of people who are actually sectioned, and that's something that we certainly need to work on, and it's one of the things that came up in the review, Mental Health Act review. I think we need to think more about the impact on Black service users, because we all know about the overrepresentation of particular groups. We don't know how that impacted in COVID, because what we were getting was impressions from AMP leads, very strong impressions, but they weren't actually physical numbers. I think, as I've said, important around really having a conversation about the benefits and risks, benefits and burdens of digital technology and mental health assessments. And finally, the big thing about PPE, we know the particular nature of mental health assessments, many in very restricted settings, people's front rooms, A&E side rooms, police stations. Then particularly, as I've said, the impact on all in terms of infection. I think the benefits and risks of digital technology, as I said, and the last thing I think I just need to say again, very important about PPE in restricted physical settings, that a lot of mental health acts assessments are done, in particular the impact on AMPs from Black and minority ethnic groups, and also the older demographic. Those groups of people who we understand from statistics are at high risk of severe disease. So that's a quick run through. So thanks very much.
Thank you very much, Steve. I just want to say as well, thank you for your time and effort and expertise with putting this report together and compiling the survey, etc. It's really been fantastic work and great working with you on that. So thank you. I'd also like to just draw people's attention to some of the technology issues that we've had this morning. Thanks for bearing with us on that. Obviously, we're all still adapting and transitioning with the technology. I'd also like to just highlight that the hashtag for this event, should you want to tweet, is hashtag AMPHP COVID report. And I'm sure there's probably already lots of tweets on Twitter already about that, you should be able to see. If I could also just remind people, please, just to mute themselves. We seem to have got an issue with the technology around muting. So if your mute isn't on, please place it on. And I'd like to just also finally say that there will be opportunity to ask questions and make comments. We have got a section on the flyer, which hopefully you've got copies to, at around 11:40. But I'm going to hand over swiftly now to Emad Lilo, who is chair of the National Black and Ethnic Minority AMP Forum. Are you there with us, Emad? I'm confident you're there somewhere, Emad. Are you just on mute?
Can you hear me?
Yes, there we go.
Can you hear me now?
Emad. Yeah, I can. Over to you. Thank you.
All right. Okay. Thanks. Very, very special thanks to the Office of the Chief Social Worker in Department of Health and Social Care and BASW for commissioning and supporting this important report. And of course, big thank you to Steve, the author, for all his hard work and commitment. I really would like to start by emphasizing that people from BAME backgrounds face multiple painful challenges to their mental health due to well-documented and evidenced long-standing structural and systematic issues, as well as recent developments. Firstly, due to suffering disproportionately from COVID-19. Secondly, the despair and hurt many people feel following the killing of George Floyd. And of course, the ongoing institutional racism in the NHS and social care. Racism is causing a profound feeling of pain, harm, and humiliation, often culminating in despair and exclusion. The persistent and wide-ranging inequalities experienced by BAME people in the UK increase their likelihood of being disadvantaged across all aspects of society. In addition, people from BAME groups are more likely to experience poverty, to have poorer educational outcomes, to be unemployed, and to come into contact with the criminal justice system. These are risk factors for developing a mental illness. But BAME people are far less likely to access the right support at the right time. We must fight racism, not just within the NHS and social care, but across society, if we want this injustice to stop affecting people's mental health. The impact of racism on mental health should be urgently prioritized by this government, particularly following the widespread Black Lives Matter protests in the UK. It is imperative more should be done across local authorities and other employers, such as the NHS, to act against inequalities and discrimination facing social workers and AMPs from BAME backgrounds. Black people not only face discrimination in the workplace, but we know they're at very high risk of catching and dying from coronavirus. So many Black AMPs wrote to me over recent months, raising concerns and really very frightened. I will share with you a few examples. One wrote to me stating, I am a BAME AMP, and during the onset of the COVID-19 pandemic, my employer has not even acknowledged how the BAME is disproportionately affected by COVID-19. Another wrote to me, we felt really unsupported, Imad, by our local authority as BAME, especially in the area of developing separate risk assessment for BAME workers and also issues around extra PPE. Unfortunately, we were forced to escalate this to our unions. And by the way, which is really painful, what that AMP shared with me, bullying and harassment during mental health assessment is common, particularly in this year. This AMP who wrote to me meant that direct racism, bullying and harassment increased during the pandemic. And last example I want to share with you from an AMP who stated, BME is reported to be one of the high risk groups for COVID-19, but no extra measures put in place to protect us. BME AMPs are still expected to go to high risk wards such as red zones or assessment in high risk areas. And this AMP mentioned police station, for example. To summarize, AMPs from BAME backgrounds have reported they are not confident that appropriate adjustments being made to mitigate risk from COVID-19, including the provision of PPE. The disproportionate impact of COVID-19 is causing them additional stress and anxiety. And sadly, they have been facing high rates of discrimination, racism, and harassment during the pandemic. We know 6 times more likely to die from COVID if you are Black. So please, urgent message to local authorities to do something about it and stop dithering. This led me, with the fantastic support of my friend and colleague Mark Trewin from the Office of Chief Social Worker, Ruth Allen, Chief Executive Officer of BASW, and my excellent colleagues across the AMPLES network to develop the National Black and Ethnic Minority AMP Forum, which was formally launched last month. The aim of which to address, promote, and champion the needs and rights of Black and ethnic minority AMPs, service users, and communities. AMPs who are interested to join this new forum, please send your expression of interest to me directly via email or Twitter, as shown on the slide. I will elaborate on the aim and objectives of this forum later at the panel Q&A session. So, in conclusion, COVID and world events have once again exposed the multiple inequalities faced by those with mental illness in our society. We know that Black people are more likely to receive poor service and outcomes from mental health services, with often very punitive measures when care and treatment provided. Also, systematic and structural racism unfortunately remains a cancer in society. But I am optimistic. I am hopeful we can overcome with understanding and action. We want to see an end to people being detained or sectioned because they do not get the help until they're in crisis. That means tackling social inequalities and stigma in society, and providing culturally sensitive services designed around the needs of local communities. I would like to finish now by thanking the AMP workforce, my colleagues, for continuing to provide excellent frontline service and, importantly, upholding human rights on the face of extremely difficult working environment throughout the COVID-19 pandemic. Thank you, and I hope this festive season bring happiness and peace to all. Much, much appreciated. Thank you.
Thank you very much. Thank you very much, Imad. Very interesting group that you developed there, and at BASW we look forward to working in partnership with you going forward on that as well. So thank you very much. I'd like to just remind people to place themselves on mute because of some technical issues that we've had this morning. So if you're able to do that for us, that would be really helpful. And also just to remind people of the hashtag, which is AMPCOVIDReport. Please tweet, that would be fabulous. I'm going to hand over quickly now to the next person on our programme, who is Claire Bartram, who's chair of the BASW England Mental Health Group. Hello there, Claire.
Hello there. It's really good to be here, and just to be boring, I definitely want to echo the thanks both to Steve but also to frontline AMPs and to AMP leads around the country. If you have had a chance to read the report, you'll see how proud the different AMP leads were of the services and the work that their AMP workforce gave during so far this year during the period that we were looking at, and I don't think that should be forgotten. I just wanted to highlight two areas which I think are of particular interest and concern. The first one was about first-time presentations, and the second is about appropriate PPE and guidance and support for staff. They do sort of, I think, bring together a number of the themes that have already been talked about. Because currently data collected by the government only focuses on people who are admitted to hospital, it is not easy to get the data about those number of first-time presentations. So the fact that we have been able to show how many areas of the country were concerned about this phenomenon is really important. It's something that we need to look at more. It also says something for challenge for mental health services into how to support people who've previously managed, they've got on with their lives, but who for whatever reason ended up in the system, how to help them get back on with their lives in as positive way as possible. It's important to remember that although people do develop psychosis, actually people get on with their lives as well, despite the psychosis. A quarter of people who have a psychotic episode will never have one again. So it's always worth hanging on to that. The second point is actually about the appropriate PPE and guidance. And this was brought up by Steve and by Imad. And I think this is particularly important because of where we would have to do mental health assessments, particularly in emergencies, and the numbers of people who've been coming into our system for the first time. So we know from previous survey work, and hopefully I'll be able to put a copy of this or a link to it into the chat. In 2017, the AMP leads did a big survey with ADAS and NHS benchmarking around the numbers of assessments that we do, and also where those assessments happened. We looked at a large range of issues. We were able to demonstrate that although maybe 60,000 people a year are detained in hospital, AMPs do 140,000 assessments a year. So there's a lot of people who we see who do not need to come into hospital and are supported in other ways. At the moment, that means there are more people who need support, because we know that more people have been referred to for assessments, particularly at the start of the pandemic. We also know that there was a concern about people becoming much more unwell before they were detained, potentially because of lack of support or the difficulty in providing support in the community, particularly at the beginning of the lockdown. One area that that initial report looked at in terms of was the ethnicity of people presenting in an emergency. People on 136, people presenting in A&E, and people presenting in police stations after arrest. And we know from that data that actually people who are presenting on the 136 are much more likely to be white and on the 136 compared to people who present in A&E and people who present in police stations. And people who present and need assessment in police stations, something like, just looking at the figures, 50%, only 50% of those people are from a white English background, compared to people on the 136 where it's more like 75%. So there is a concern that if people come into the mental health system via the criminal justice system, they are more likely to have come from a black and ethnic minority background. And we really need to understand that and think about how to support people to move on. And as Imad has said, get the support they need early so that they don't escalate into a situation where they end up being detained. And then my last point was the notion of PPE and appropriate guidance. One of the things I think, or one of the challenges we have now going into this coming winter, the winter that's already with us, is how we support people who, if they're AMPs, are more likely to be older. They are more likely, or they're definitely coming from a range of different backgrounds, to feel safe enough to do our jobs properly, and to also do an effective job in terms of communication. So I'm very keen and would strongly urge the Department of Health and Social Care and all the relevant bodies to actually look at the issues of the need for proper PPE and proper guidance for professionals who, not just AMPs, but in our case, particularly AMPs, who have to do assessments in a confined environment over a period of time. We know that assessments can actually last up to an hour, 2 hours with very complex assessments. And you are likely to be in a small space. You are likely to be in somebody's front room. You are likely to be in a very small box room off of A&E or in a 136 suite. All of these are places which would be conducive to the spread of COVID. So to have appropriate PPE and to be able to support social workers, AMPs, other people who are doing those jobs in the community to have the right guidance and to have the right PPE, I think is essential. And I'm going to stop there so you can ask some questions.
Thank you very much, Claire. Thank you for that, and also thank you for your input on this project as well and moving it forward. So looking at the programme for this event, we're now at the point for question and answer. If I could invite you to put your questions in the chat box, please, and my colleague Gavin will collate those. And our panel of speakers who have spoken so far hopefully will be able to respond to those. So just thanks again to Steve, Imad and Claire there, and open it up to to our attendees this morning. Gavin, do we have any questions already that you'd like to ask?
Yes, thanks, Wayne. I think there's quite a few comments, but one question that came up earlier, and you might be partly answered this already, is any questions on any additional points about people from Black and ethnic minority backgrounds, any in terms of the breakdown of numbers of people who are accessing services?
Okay, Steve, probably best.
Should I just answer that? I saw that question come up, and hopefully, I mean, there was some comment at the end of my presentation, then EMAD covered it in some length. The simple answer is no in terms of this survey, and I think the reasons we've given them to a certain extent. A, it was an impressionistic survey with a lot of information coming back, but equally it's very, very difficult to get. There is no national reporting of activity, AMHP activity, and any reporting of detentions in hospital will not, for this year, won't come out until another year away, or 18 months. So at the moment we don't. So that's why I think it's really important to explore that further and see how we can, because we can ask people. It's more work for AMP services to pull that figure out. I do know for a fact that many AMP services do keep their own figures, but there has never been, and there is no national reporting system. So it's very much down to each individual service. So we don't know the actual figures other than the impressionistic responses we got. And when I say impressionistic, I don't want to downgrade them. They're very important responses, and they're responses from people that know what's happening on the ground, but they're not figures.
Okay. All right, Steve, thank you. Gavin, any further questions or comments, please?
So yeah, there's a couple more which are coming through, but I'm just going to follow up on a comment that came from Kev, talking about how this has exposed the impact of poverty and inequality generally on the social detriments of health. So it's, I think, taking a question out of that is, has there been anything that you've heard from respondents on inequalities such as poverty in terms of mental health service access?
I think that one of the issues, and people will know this, most of the people on this in this meeting will know this, AMPs come to the table when the crisis is at its greatest, and other people have talked about this, that it's either because of the person's individual circumstances, and also we believe very strongly, and there is significant evidence that it's because of a failure of other elements and management of the deterioration of somebody's care, or other psychosocial issues. And I firmly believe that poverty and economic issues are very significant in terms of mental health. So we haven't picked anything further up on this survey. This survey was very much about the time of assessments and the impact of the moment of assessment. I think it's something that the other issue is whether or not the lack of support for people who are already linking in with services. But that doesn't actually look at the poverty side. It doesn't differentiate different areas of deprivation. Equally, we haven't got the information for the same reason as I said before in terms of the Black and minority ethnic group statistics. We don't have that information. It'd be very useful to have that information, I think.
Okay, Steve, thanks very much. I can see that a couple of our panelists have got their hands up and been waiting patiently. So I'll bring you in, Mark.
Yes, thank you very much, Wayne and Steve. Hello, everybody. I'm Mark Trewin. I'm the mental health social work lead at the Office of the Chief Social Worker. I'm speaking in a minute, but I just wanted to join in with that question about equality, because one of the things that I was very pleased to take part in this year is the Centre for Mental Health's Equality Commission, which published its report a few weeks ago and specifically talks about how inequality, poverty, and the social determinants of health and care have affected people with mental health issues, and references within it not in a huge way, but make some reference to the AMP role and also the important role of local authorities and mental health social work as well. So I would really refer people to that document. I think it's one of the best documents we've had recently. And the Joseph Rowntree Fund also did a really good document recently around how poverty has been accentuated by COVID.
Fabulous. OK, thank you, Mark. Claire.
Hello, thank you, Wayne, for that. I just thought I'd let people know that I've put the CQC's report on the state of the mental health, what's it called? State of care in the chat. And although, again, they can't give us some of the data in terms of gender or race, they do actually make the point that they're concerned about the impact of the pandemic on Black and minority ethnic people, and the way in which people come into contact with mental health services through A&E, where they may not be, they may be exposed to infection or via the police. So I think it's worth having a look at that, and they do also have some data there about the way in which the numbers of people detained under the Mental Health Act initially dipped during April, potentially because of discharges, but has since gone back up to at least normal.
OK, thank you, Claire. Gavin, before we move on, are there any other questions at all or comments in the chat?
There are a few, and it's knowing which one's the best to pick out, but I'm just going to go through them systematically. One of them here is from Ruth saying, can you say more about how AMPs have stepped in to cover deficits in community services? And how do you think AMP work will be affected next year and the year after as we recover from COVID?
Shall I reply on that one? Yeah, there was a very strong response about certainly a feeling, and more than just a feeling, that they were undertaking work that normally would be undertaken by community services, non-crisis services, certainly during the first lockdown. And clearly, one of the suggestions in the report is that the community services shouldn't just shut up shop in future lockdowns, and they haven't done. My understanding is, so that's a benefit. Certainly there were some examples given, and I think I haven't got them to hand. I think I put some examples, quotes in the report about where it's quite evident that referrals have gone to AMHP services and services which would only because nobody had seen the person for a couple of weeks or a few weeks, not because there was significant evidence that the person would need to go into hospital. So there was some real concerns about that at the time. So I think there was some real evidence about that, as well as just a feeling. For the next year or two, I'm quite concerned, because just thinking about the information we've got about new presentations, a lot of stuff in the media about the impact on people's mental health generally and mental welfare. Also, like I said, there's the comment from the police about more new presentations. It's not going away. The stress and anxiety continues, and therefore it seems to me not unreasonable to think that it will continue to impact on people's mental health. Now, clearly, the majority of people will manage in different ways without needing consideration on going to hospital. But if you think about, 10 or 20% of those people will potentially need an assessment for a hospital admission, that means you're likely to get a greater demand over a longer period of time because of the impact of this. So I think, that's my concern, because, we're all not going to go away and get it all sorted and forget about it in the next 2 or 3 months, that's for sure.
Thank you, Steve. A question I have actually is it's for Emad. Emad, if hopefully you're unmuted there. I just wondered what your vision was for the Black and Ethnic Minority AMP Forum that you've developed over the next 12 months. What's your vision for that group, please?
Okay, can you hear me?
Yes, thank you.
Okay, great. Thanks for since the launch. We have over 50 members already, which is fantastic take up. According to the latest report from Skills for Care about AMP workforce, 14% of which from BME backgrounds, BAME backgrounds. So that equates with the total of AMPs nationally about 3,900. Is that right, Steve? So out of which we estimate around 500 from BAME backgrounds. So the ambition is to have as many of them to join the forum, to have that support. And we are planning to have 3 to 4 events next year in order for AMPs from BAME backgrounds to remain connected and not feel isolated. Because the reason we set up this forum is the sense of isolation and the sense that, you know, they are not being listened to. Some of them felt that they're vulnerable, and so on and so forth. And of course, in addition to the Black Lives Matter movement and the COVID-19 pandemic, all of that led us to set up this forum. But what I call local authorities, employers, to start having their own localized forums, groups to support social workers, AMPs from BAME backgrounds. It's important, it's imperative. I really thanks, I mean, what I am keen to relay the message to employers in relation to race. We have gone backwards, and I've said it over the last 2 to 3 years. You know, and I'm not going to shy away. You know, we need to address the shortage of people from Black and ethnic minorities in senior management. I often, when I was working in the NHS, sat the only person of colour surrounded by 20 to 30 white faces. So, you know, it's important that we reach out and address that. And again, the purpose of the forum is to set up some form of mentorship, you know, mentoring AMPs and develop them. But we are going to be relying with the support of their employers, the local authorities and others like the NHS and so on, including the volunteer sector. So, and a way of developing this often, we're going to develop it, we're going to let it develop naturally. I have fantastic support from the steering group members of the National AMP Lead Network, Steve Chamberlain, Jill Robinson, and Abu Bakar. And they've been fantastic, really linking the north of the country and the south. So we have good representation from across the country. So we will be sharing the dates of next year events. And I am encouraged, Mark Trewin from the Office of the Chief Social Worker, his support has been excellent. Yourselves, BASW, Ruth Allen, I think I'm really optimistic that we will be able to reach out and support a lot of AMPs, particularly those who are feeling really vulnerable and isolated. Okay. So thank you, Wayne, and thank you for everyone for supporting this initiative.
Thanks very much for those insights, Emad, and that group sounds really exciting. I'll be observing and sort of engaging sort of where we can on that. Gavin, before we move to the break, which is due at around 12 o'clock, are there any burning questions there in the chat or comments that you've come across?
Well, helpfully, I can see Steve has been answering some of the questions, which is good because there's been so many. But yeah, I think I'm going to zone in on one. No particular reason why I'm picking this one out, but it comes from Najma, and it's quite it's quite detailed. So just bear with me here. I have an issue, may not just be relevant to AMPs, but for people to AMP, but for people with pre-existing conditions. Let me just, I'm going to have to paraphrase this. So there's an issue with people with COVID being classed and marked as no resus, and she's raising the issue of human rights and the breaching of patients' rights and them being denied the right to recover with medication. So the question is BASW or the AMPS network doing anything about it?
Okay, thank you for that. Steve, I'm going to come to you on that one in terms of the AMP Leeds Network response first, if that's okay. I can see Ruth Allen is still on the call as well from BASW, so Ruth may want to reply to that. But Steve, if I could come to you first, please.
Sorry, I mean, I was just replying to another question there. I got most of that. Can you just sort of, Gavin?
Yeah, sure. So there is a point here being made about people with COVID being classed and marked as no.
Oh, right. Yeah, the DNAR. Yeah, no resus. Yeah, sorry, I got it, and then I went a blank because I was just doing another question. Yeah, I think that it's come up in there's a CQC report about that, and I think that I mean, I can't speak for BASW, but I think that for me, I mean, the bigger issue here is people in care homes and people under the deprivation of liberty safeguards issued. I'm not quite sure how it directly relates to Mental Health Act assessments and detention under the Mental Health Act, because it didn't come up in the survey, that's for sure, but we didn't ask that question. I get the impression that it's more likely to be people that are much greater frailty and more likely to be in care homes and with other forms of disability than the mental health, acute mental disorder, which leads to detention in hospital. So I think from the AMP side, I would say that, I mean, I might be wrong. People will correct me if I'm wrong, but I think it's more of an issue in a slightly different part of the professional group, really.
Okay, thank you, Steve, for that response. Ruth, I can see you've got your hand up. Can you hear us okay?
Yeah, can you hear me okay?
Yeah, fabulous.
Yeah, no, I just came back in on that point. It's a really important point, and BASW has, through Policy and Ethics and Human Rights Committee and through other parts of the organisation, absolutely been speaking out where it's been evident that there have been blanket do not attempt to resuscitate, or certainly strong allegations of that and some evidence of that happening, say, across, all people within care homes, etc. So yeah, I think he's right. This is mainly about the operation of the Mental Capacity Act. I just want to make 2 points though, which I think affect all social workers that we're working on. One is that BASW is supporting the campaign to enable carers to have good access to people in care homes and other institutions. And we've joined with National Care Forum and other organisations on that quite big and I think a very effective campaign. Family members are essential to ensuring that people's rights are upheld. That's one of the many reasons why people want to be able to go and see their loved ones. And the other campaign that we're running across England and also across the other nations in the UK is to ensure that social workers can discharge their duties as professional visitors into institutions, care homes, obviously hospitals, secure facilities. That involves having access to testing going forward, or have early access to vaccines. So again, that social workers can play their role, and that would include AMP social workers in ensuring people's rights. The last thing I would say is that it's always struck me that we need to social work whenever we go into an institution or into a setting, whether it's secure or not secure, care facility, wherever, whether you're an AMP or another social worker, is as our responsibility to be aware of the regime of care that is generally prevalent in that facility. We often are focused on the person that we're dealing with directly, and that's really important. But we also have a responsibility, I think, to make sure we're asking questions around that and around the regime of care, so that we're gathering that intelligence. So, social workers are very busy. You have very focused, detailed work to do with an individual, but we have to be thinking about the quality and the human rights within the organisations that we're also visiting.
All right, thank you, Ruth. Thank you for those questions and comments this morning to our audience. We're now at the point of the break. We'll be breaking for 10 minutes. I think we're just after 12, so if we come back just after 10 past, I make it around 13 minutes past to be precise. If we resume then, we look forward to speaking to Mark Harvey from the Office of the Chief Social Workers and from Melanie Brooks from ADAS. All right, see you just after 10 past. Good afternoon and welcome back, everyone. Hopefully you've had a chance to grab a drink, pop to the loo, and we're now refreshed and ready to start the second half of this event. I'd just like to reiterate the hashtag for this event, which is AMHP rather, COVID report. And also just a reminder just to mute your microphones, because we have had a technical hitch this morning, which has prevented us from doing that. I'm really pleased to hand over now to Mark Trewin from the Office of the Chief Social Workers. I know unfortunately Mark Harvey's not able to join us. We were hoping that he would be able to, but I'm delighted to hand over to Mark Trewin, who is going to take us through your presentation. Thank you.
Thank you very much, Wayne, and hello to everybody. And I'm absolutely delighted to be here and to be able to support my colleagues in both BASW and the AMP Leeds network in launching this really important report. And I want to, like everybody else, I want to start by thanking AMPS for everything that you've done over the last year while COVID has been causing us so many stresses and pressures. And we have been monitoring and talking to AMPs across the country and AMP Leeds, and we're very aware of just how hard everyone has been working and how services have been redesigned in order to try and meet this very difficult situation. So just to start by explaining where Mark is, because Mark was going to join me today, but he's actually been called away to speak to the Permanent Secretary of the Civil Service. So that's how important he is these days. So my last words were to him as he went off to go to that meeting was, don't forget to mention how important AMPs were, and he promised that he would. So it leaves for me to talk about the role of the Department of Health and Social Care in this. And DHSC, we were very proud and pleased to be able to commission this report from BASW and the AMP Leeds network. And we commissioned it because we very much recognise the vital role that AMPs play in mental health services, working across so many agencies, leading complex assessments under the Mental Health Act. And we, as I said, have been keeping in touch with AMP services across the country. And we know that AMPs have redesigned their services to meet COVID. We know that they've balanced the important role of caring for service users in mental health crisis, whilst also trying to protect staff and dealing with a lot of new rules. And I think the thing about the AMP role is that when you're working across so many different agencies, ambulance, police, psychiatric wards, community mental health services, and local authorities, there's such a complexity of different organisations that you have to try to deal with. And AMPs have stepped up to this brilliantly well. One of the things that we've been doing is really pushing the importance of the AMP role within Department of Health and Social Care and within NHS England as well. And I'm not sure whether you're aware of this, but you know, the Mental Health Act easements were never used for mental health, whereas the Coronavirus Act was used for the Care Act. One of the reasons that the Mental Health Act easements were never used was because we were able to demonstrate to NHS England and the Secretary of State the way that AMPs were dealing with the situation. The two main groups that were fed through into this was mental health trusts and local authority and NHS AMP services. And so there was a really important role that AMPs played in giving government an idea as to how coronavirus was affecting the Mental Health Act. So we've been incredibly impressed by how AMPs have continued to work face to face when a lot of other services have gone online, and completely committed to caring for the needs of people in mental health crisis. There's really important lessons to be learned, and in the CSW's office we will be making sure that the lessons within this report are fed into the highest level at the Department of Health and Social Care and NHS England, and I want to explain in a minute what that means practically. But first of all, I wanted to say that it's really important, the timing for this, because we know that the Mental Health Act white paper is due to come out possibly in the first week of January. We don't have an exact time for it yet, but certainly we're very hopeful that it's going to be published soon, and we know that it's ready to be published and that the government is supportive of it. And within the Mental Health Act white paper, the Mental Health Act review, I think there's going to be an awful lot of the questions that are coming up today are going to be dealt with, and are going to be dealt with in a consultation document. So one of the things that I would say to all of you, AMPs and AMP Leeds and local authority and nursing and occupational therapy leaders out there in the mental health services is to prepare yourselves for being able to respond to the mental health white paper when it comes out. So some of the things we've been talking about today is around data, and there's a big suggestion as to how we might improve data, not just about AMP personnel, which I think Steve and Skills for Care have done a fantastic job on, but also about AMP activity in the future. Also around things like conveyance and all of the issues we've been talking about in terms of ambulance services, Section 140 and how relevant that is and how it's being used, issues around community provision, particularly for mental health, learning disability children, the experience of Black people under detention and how that can be improved is a big theme in the Mental Health Act review. And somebody mentioned Section 117, which I answered in the chat, and Section 117 will be part of the consultation process that comes out of the white paper. So prepare for that. It's very important. So one of the things about ensuring that agencies recognise the important role of the AMPs and social care within local authorities and within the NHS. And Mark and I are very committed to making sure that everybody in Department of Health and Social Care understands that AMPs have a really important role within the mental health services. And I know I can recognise from some of the names that came up as we opened this today that there's quite a few people who came to a big meeting with the Minister for Social Care with me a few weeks ago and were able to really pinpoint to her the important role of the AMPs. And we've done that with the Mental Health Minister as well. We've done it with NHS England. The adult mental health team are in no doubt about the important role of AMPs, and we've done it across both the mental health and the adult social care bit of Department of Health and Social Care as well. And this is really important because as part of the development of the Mental Health Act review, we have tried to work with the LGA to look at what kind of financial support is going to be needed in the future for AMPs and new burden assessments as to the suggestions that are being made within the Mental Health Act. So there's a couple of things that have come out of this report. I'm not going to repeat everything that Stephen and Claire have said. It's really helpful, the report, but some of the things that we're really going to be pushing within the Department of Health and Social Care is, number one, I think, PPE. Now, Mark, Harvey and I pushed this already. We made sure that at the beginning of the COVID period that people understood that AMPs and emergency duty teams, because we didn't forget them as well, needed very, very swift access to PPE. And when you look at the responses that have come in, we can see that that's really worked well in some areas and not at all in others. So there's huge variability there that we need to get sorted. We can't have some areas getting the service and some areas not. The other issue that's really important is around the effect on staff and the workforce, and particularly as EMAD has put forward, the Black and Asian ethnic minority workforce. We're really pleased to be able to support EMAD. The webinar that started that group was really positive, I thought, and this links into some work that the Chief Social Worker's Office is doing, which has been very well supported by DHSC, which is around the development of a workforce race equality service and plan for social care that links in with the NHS workforce race equality plan. And of course, as part of the Mental Health Act review, we've got what's called the patient and service user race equality framework, which we're also linking AMPs into as well. One of the other things that we feel is important and we're trying to do, and we're going to do more using this report as evidence, is around research. Because one of the things that struck us in the development of the Mental Health Act review was that we often didn't have a research base for some of the things that we felt were factual. So, for example, Section 12 doctors. When you look at the number of Section 12 doctors available in Britain today, it looks like there's enough. And yet when you talk to AMPs, it's very, very obvious that in certain areas of the country, getting hold of those Section 12 doctors can be quite problematic. So the Department of Health and Social Care has asked King's College London to look into this. They've produced their first report, which is a literature review, and some of you will be being approached next year for the second part of their report, which is to actually look at practical research on the ground with AMP services and mental health trusts around why it is, trying to understand why it is that Section 12 doctors can be difficult to access in some areas. I was very pleased to take part, along with Steve and others, in the NHS England guidance on technology. And I think there was some confusion about that, because I think that when you read the guidance, it doesn't say anywhere in it that NHS or Department of Health and Social Care wants the core aspects of the Mental Health Act to be overturned or overruled in any way. Section 11, Section 12 is extremely important, and we cannot just bypass them. Now, what we wanted to do was to give AMPs some support when they were in a position where they were having to make very difficult decisions, when they were trying to implement the law as they understood it, but because of coronavirus, it was very difficult for them to do that. So we wanted to give them some protection, some support from the government, that they could use some flexibility. And I think Steve's absolutely right. As we go forward, we're dealing with a mental health act that was designed when mobile phones were enormous bricks that were just used by yuppies in New York. And now we've all got one, and it's a very different situation. So there's a huge amount that we will be doing. So my promise to you, I suppose, is that Mark, Harvey and I, as long as we remain in this post, which is currently until March the 31st, we will be pushing the needs of AMPs first, mental health social workers second, local authorities third, with every part of the Department of Health and Social Care and with NHS England. And we will be ensuring that this report and the lessons from it are on the desk of all the ministers involved and all the leading civil servants involved in creating policy, and that we make sure that there's ways in which we can discuss how we're going to implement the lessons of this with them and with our colleagues over in NHS England as well, who I know we're all invited to this, and there may be one or two of them listening to this. So I just wanted to end really by thanking you again, making sure that you understand that however it might feel in terms of media and you know the whole shebang of working in social care in the NHS mental health services at the moment, that within this Chief Social Worker's Office we appreciate how hard you're working, and thank you very much for that.
Thank you very much, Mark. Thank you for those comments and observations. I'm just conscious of time, so without further ado, I'm going to hand over to Melanie Brooks from the Association of Directors of Adult Social Services, also known as ADAS. Hello and welcome, Melanie.
Hi, thank you, Wayne. Good afternoon, everybody. It is the afternoon now, isn't it? I thought I'd better remember to do that as we started in the morning. So I'm Melanie Brooks. I'm Corporate Director of Adults and Health in Nottinghamshire, and I'm also the ADAS Mental Health Policy Lead. I'm really proud to be supporting the recommendations made in the survey, in both of those roles actually, and playing a part today in making sure the work of AMPs is better understood, recognised and supported. So I think as Directors of Adult Social Care, we employ AMPs, we authorise AMPs, and hopefully we create conditions that are safe for AMPs to work in. So what's really important for me here really is the fact that AMPs, I think, are at the interface between the individual and the state. It's real classic social justice work. And also, as well as that, you're at the interface of the professional and organisational boundaries, which creates a huge pressure, including the boundaries within the family, the carers and the community. So you tend to be in the middle of a perfect storm on a daily basis. So I think with that in mind, there are three key areas that I'll be hoping that both ADAS and your, my fellow directors have a role in implementing these recommendations. So I'm going to say a little bit about each one. I think the first is about professional leadership. So in ADAS, we have a really strong and effective mental health policy network. So many people speaking today are part of that, and very important colleagues. We have people working with us with lived experience. We have partners from the voluntary and community sector, NHS partners, and really our role there is to make alive the daily work of AMPs live at a national level, and to inform directors of adult social care how to improve the lives of AMPs. I think standards is really important. Here's some of the AMPs in Nottinghamshire demonstrating some of the latest professional standards. It's really important that we do so, that we think about the supply and of PPE and guidance. That's really been important for me in Nottinghamshire. I know ADAS has worked really hard to make sure that social care PPE is a priority across the piece. Well, I think recognising that others may have different experience than other authorities, but I think that's going to be really important to continue to do that. We need to really understand the specific risks that COVID presents to us, not least because the risk to us individually because of infection, but also because of the restrictions on social contact, liberty and rights. And we need to continue to adapt what we do and maintain the highest professional standards. So I think as we start to find new ways to adapt and overcome them, ADAS will continue to support this with sharing best practice and giving advice. I thought I'd just share a little bit of a slide here with you about in Nottinghamshire. So one of the ways that we found to adapt some of this way of working, this is me terrorising our trainee AMPs. So I've been convinced to be a mock magistrate, holding a pretend court and making sure that trainee AMPs are really prepared in order to secure those all important warrants. So as we start to develop these different ways of supporting professional leadership, it's really important that we continue to share that across the piece. The next bit I think that's really important is systems leadership. So ADAS works really hard at national level to build an influence in relationships with key people, and hopefully will be an ally to AMPs, an advocate about the role of the AMP. So nationally we work alongside the Chief Social Work Office and try to influence Department of Health, NHS England, NHS Improvement, which we know are hugely influential on the daily life of AMPs. And locally, we work with our key partners in a similar way. So that's going to be really important. I think we're really committed to trying to create the right conditions for AMPs to work in. So this slide is my AMP lead's new office. So she has PPE in her garage and as a virtual world. So we need to make sure that those conditions, seriously though, are the most supportive, and I think particularly challenging the barriers that exist to good practice. So COVID has really, I think, heightened the risk of conflict and tensions that can arise because of the role, and the report sets that out quite clearly. So now we need to be making sure as ADAS and DASs that we can continue to support that work. I think lastly I wanted to talk about is culture and well-being. So I think ADAS and directors have a key role here. So we need to create a culture that enables AMPs to thrive, encourages people to want to train an AMPs and continue as AMPs, and that helps to build a sustainable AMP service. So on the slide here we've got a lamb. So we've got a team mascot in Nottinghamshire of a lamb that was born on one of our AMPs farms. We're a bit rural in Nottinghamshire. It's not the same for some of you that have come from the cities. So this is our AMP mascot. We work really hard to make sure we support well-being, that we recognise the pressures that staff are under, and the tensions that things like the working patterns have that can exhaust our AMPs at times, as well as preparing people with key skills. So for me, this is things around strength-based practice and some of the professional elements around the Act, but it's also about some of the day-to-day things like having digital confidence, being able to have particularly those working in a working from home sort of basis, that they've got the right kit around them. So there's some very basic things I think we need to pay attention to, as well as some of the more technical professional leadership elements. And really I just wanted to end with a bit of a thanks. So this is some of the team in Nottinghamshire, but this is a general thanks to all of you AMPs. I think we really do recognise the pressures that the AMP workforce are under, and how important that unique role is about safeguarding the rights of people at the time of crisis, and having at the heart those rights of everything that AMPs do. So thank you very much.
Thank you very much, Melanie. Thank you for taking us through that. We pretty much reached now towards the end of our programme, but we're at the question and answer session for the last two speakers, Melanie and Mark. So Gavin, do we have any questions or comments in the chat that you could share, please?
Thanks, Wayne. There's been quite a lot of discussion, and again, thanks for the people who've been responding to some of those already. But something that has come out more than once is the lack of access of Section 1-2 doctors and availability. I think it's more of a comment and a concern that people have. So I don't know if there's any thoughts about that.
Any thoughts from that, Melanie or Mark? If you're still there, Mark.
I think to echo Mark's comments about being important in the consultation to mention that, I know certainly we hear this in the network, and I hear it locally where it looks like on paper there's a really good supply, but that's not the lived experience of an AMP, particularly at certain times of the week and certain times of the day. So I think it's important that those issues continue to be raised and fed into the consultation. I don't know, Mark, if you wanted to add anything else.
No, I absolutely agree with you. And I think the thing about Section 12 doctors is, if it's not the number of them, then what is it? And I think that that's what we're trying to find out. And to me, I think it's about the contractual arrangements that NHS trusts and CCGs have with doctors. So, you know, if the law says that somebody should be available, then we need to make sure that they are available. And I think so. I think that there's a lot of work that we're doing with NHS England to discuss this. And I know that Steve has said in the chat about whether or not the Mental Health Act white paper is going to put a duty on to CCGs and mental health trusts, just like the duty is on the AMPs. And at the moment, I don't think it does, having seen various drafts of it. But I think if we feel strongly about that, we should mention that in the consultation to the white paper when it comes out.
Okay, thank you. Yeah, just before you come in there, Gavin, just Steve, I'm just conscious that you might also want to make a comment on that particular question. Would you like to?
Yeah, well, I made some comments in the chat, really.
Okay.
But just to reiterate, you know, I was involved in the giving evidence to the review team before the review was published now a couple of years ago, and I certainly made the statement saying I thought there should be this mirror duty on the NHS to provide a doctor's or a doctor mirror image on the Section 13 duty on the local authority. But you know, it didn't get into the review document, and as Mark said, I didn't expect it to get into the white paper. But as Melanie has also said, I think that doesn't stop us continuing to push either for a duty or for at least some strengthening of the expectation of getting doctors, because it is so variable, and there's lots of stuff, you know, it's been raised today. Some places have better organisation, and we're going down other routes of having apps, which is great, but I think the bottom line is there should be a duty.
Okay, thank you, Steve. And just finally, last but not least, Claire, would you like to make any additional comments in relation to that?
I think I would agree with Steve. I think it is a really big issue for AMPs. I run an EDT team. I do a mental health assessments in the middle of the night, and I can tell you it is really difficult to find someone at 3 o'clock in the morning when they finally find a bed, and somebody is wanting us to do a mental health assessment. So that does need to be addressed, and I think there's an opportunity with the response to the white paper to actually put that point across.
Thank you, Claire. Imad, is there anything you would like to mop up in terms of what hasn't already been said? Oh, you're on mute there. You're on mute there, Imad. Oh, was that a head shake, was it?
Apology, I've got no further to add.
All right, thank you very much.
Very
no
well.
All right.
I see Mark and Claire. Thank you.
Excellent. Okay, Gavin.
Can I just?
Yeah. So I was actually going to say, Mark is offering to answer the question. That was exactly the question I was going to ask. So it was about bed availability. So.
Okay. I think Steve had an additional comment. Did you want to come in, Steve?
No, I mean that was just. I just noticed a few comments about bed availability coming up, and I made a comment about that. A reply. You know, it's a chronic problem. We all know it's a chronic problem, and obviously the survey really talked. I really need to focus on stuff which was relating to the pandemic and the lockdown. Now, I did include some of the chronic problems, but only where it was evident that they had been exacerbated further. Bed availability is one of those. I didn't talk about it today. Around, you know, some wards being transferred to COVID wards, and also whether you have people prior to being cleared of infection in a different circumstance, in a different ward or in isolation. So bed availability did deteriorate. And the other big issue is we know people are being moved sometimes hundreds of miles away from their home environment because of a lack of beds. That got even more complex with COVID and with the lockdown. But you know, this predates the pandemic by many, many years, and it's something we really do need to address. The other issue around bed availability is about children and young people, which is another big separate issue as well, which needs to be addressed too. Okay, Steve, thank you.
Yeah.
Gavin,
if I can add to that, Wayne. Yeah, I just really wanted to mention, because somebody keeps putting bed availability in, and I think it's really important that we mentioned it. And I think it's really important, but I wanted to go into a little bit more detail rather than just saying bed availability is important. because I think this is something that is an absolute top priority for the government at the moment, and it's a top priority for NHS England. And there's a huge amounts of work going on both in learning disabilities and children's, and particularly in adults, around reducing out of area placements, as Steve has just said. And one of the things that the recent figures have shown is that it's actually been getting slightly worse. And this is pre-COVID, and we're expecting it when the figures come out for post-COVID to have got slightly worse again. And so one of the things I wanted to say is I think that we need to use the voice of the AMP and local authorities and people like Melanie much more strongly in this, because bed availability is not just about building more beds. That is an important thing in some areas. There are areas in the country where there are genuinely not enough beds, but bed availability is actually more about a whole system working together. It's about where the police take people if they've picked up on 136. It's about the provision of step down housing. It's about, well, how good the community services are. It's about how people use the Care Act. It's about how we stop people from going into hospital, how we deal with crises. It's about a whole range of things. And I think that the problem we've got at the moment is that the government is tending to see bed availability as an NHS issue, whereas in fact it is a whole system issue, and we need to have a much stronger voice from local authorities and AMPs about this, I think.
Can I just add something, Wayne? I mean, I would agree, Mark. For me, I kind of shudder when people raising the bed availability, because we've almost failed if we got to the point where we're needing a bed to be available. You know, we need to be considering about what alternatives we need to be commissioning and providing in different local authority areas to meet people's crisis mental health needs. And utopia, isn't it? I think someone mentioned it earlier. I think it might have been EMAD, but we don't have people having to be detained because they're receiving a crisis support. So for me, it should be much more about the investment in that crisis support and supporting people to stay in the place that feels safe to them, preferably their own home. But if that's not a safe place, somewhere else that's safe that isn't a hospital would be sort of my vision for the future. But I know that doesn't answer tomorrow's problem about a bed being available at 2 o'clock in the morning, so I do recognise that.
Okay, thank you very much for those responses to the panel. Gavin, I'm guessing that there are still lots of other comments in the chat and questions, so any others? Any other prominent themes?
I mean, I think there's, looking at some of the comments that have just come in, there's been talk about, and a discussion also about trying to opt for the least restrictive options, but I think people are talking about geography being an issue and people being transported to across long distances, and there's something about timely discharges. Yasmin has been talking about concerns about there's not always been a timely discharge, and that's creating a problem as well.
I know that's something that we've discussed for a long time in the mental health group at BASW, so I'll see if Claire, do you have any comments that you would like to share in relation to that comment?
In terms of having access to local resources in the community that support people, I mean, I think it's really, I work in Islington. We have a women's crisis house. It still amazes me that we're probably one of the few places in the country that has a women's crisis house. And you just think, why? Because that enables women in crisis and women with children actually in crisis to avoid going into hospital. Yet you don't see the same resource in other places, and I think that's something that we really need to sort of emphasize, as well as the fact that when you need a bed, you need a bed, and we need to do something about that as well.
Can I just add?
You've got your hand up.
Yeah, just quickly, about the bed availability question. I absolutely agree with Melanie and what other people have said. And I've put in the chat really. I mean, I think it's an easy shorthand to say bed availability, and we do need sufficient beds when they're necessary. But as Claire's just said, you know, if in the middle of the night or in the middle of the day you have a response which will a resource which can provide an adequate response. That's what's really necessary for AMPs. It's not simply about beds, and we should make sure we're not seen as simply asking for more beds. I think that's important. I know we're not, but I think we need to be. There's subtlety about the demand. I mean, clearly we shouldn't be transporting people hundreds of miles, but it's more about the adequacy of resources to respond to people in mental health crisis.
I think I'd agree, and I think there were some comments, weren't there? So Claire mentioned sort of some women-led resources, but we also know from some places around the country that it's about culturally appropriate crisis response, Black-led provision, peer-led provision. There's a whole range of interventions which sadly seem to be in the minority rather than part of the, I suppose, the DNA of what mental health services provide. I think there's an opportunity, I would hope, for some of the community transformation work that's being led by NHSEI to have some influence about that long-term transformation, because that is meant to be a vehicle for transforming that offer. And that does talk about some of the requirements of the Mental Health Trust to have these initiatives to be co-producing. I think that's probably quite a far stretch for the reality of some of us might experience in our local areas. But I think that will be another thing really that I think both ADAS and directors of adult social care should be seeking to influence.
Okay, Melanie, thank you. And Emad or Mark, would you like to add anything to that?
I think I would like to slightly change the subject, because there's a lot of comments about Section 117 in the chat, and we haven't mentioned that yet.
Okay, and, let's move on.
So I just wanted to very quickly say that I think Section 117 is one of the areas in which perhaps we didn't make the impact that we wanted within the Mental Health Act review. However, when the Mental Health Act white paper comes out, I think it is likely to have a comment in it about the need to simplify and modernise Section 117 and to make it more appropriate for a wider range of people, and to support better integrated working across health and social care. And so therefore, I think it's a perfect opportunity for those of you who know what you're talking about in the local authorities to be able to respond to that consultation with very clear ideas about how that should be achieved. And I would really recommend that you do that if you can, because this is a fantastic opportunity for us to be able to perhaps do something about that.
Okay, thank you. All right, so I think that's responses from most panel members with regards to that question, and a little bit extra there in terms of Section 117 from what Mark was saying. Is there anything additional in the chat there, Gavin, which we've not already covered in terms of themes?
Yeah, I mean, it might be one that's difficult to answer at this point, but I'm noting that there's comments about some authorities and some employers not really having the right provisions in place. One person's talked about there being a lack of a crisis team in her area, and another one just talking generally about feeling that their local authority doesn't really know what a crisis house looks like, and they're talking about one specific area there. So it's and then there's a comment, and I can see Kev's mentioned this more than once. It's about the going for the least restrictive option, so clearly that's a theme that keeps being mentioned here. But there's a few things there, and it's more themes really, because they're not always questions, but I don't know if it's a response to them.
Yeah, are there any thoughts around that to our panel, sort of crisis teams and the variations of those across the country? Mark?
Well, I once helped set up a crisis team. I think somebody needs to go on mute there. Yeah,
I think so.
Okay.
Just try again for us, please, Mark.
I'm a huge fan of crisis services. However, I am going to say this. I think that the problem we've got at the moment is that we have, in many areas, crisis services separated. There's an issue around how they're funded, and there's an issue around how they're supported, and there's an issue about what the government understands as being crisis services, and how the money goes through the system. So I'm very much a big fan of us funding both health and social care to provide crisis. And I'll give you some examples of this. Right, in my experience, an awful lot of people who go to A&E with mental health crisis have a mental health crisis based on a social issue. right? And yet very rarely across the country do we see social workers or even commissioned VSE social support services being placed in A&E to help with that. It's almost always 100% health and nurse led. And so I think there's a real opportunity here for new models of integration. And I'm not talking about big Section 75 organisations all moving together and everyone having the same HR, because that is, I think the days for that have passed really. But I'm talking about proper partnership working where we actually recognise the skills of social care and social work and AMPs and put them in places where they can actually make a difference.
Okay, yeah, thank you.
Slightly radical point to end on there, Wayne.
Well, I imagine that there will be some supporters of that, Mark, knowing what I know from our mental health group. So thank you for that. And I can see Claire's got Claire, any thoughts that you have on that, please?
I was actually going to make a very similar point to Mark, which is that a lot of crisis services at the moment tend to be very health orientated. And that's partly because of the way the money comes into the system. And I do think that's a shame. I think that it's been a shame because I've known of I have a friend down in Brighton who set up a really amazing peer support crisis service, which lost its funding because it was the funding that started off as extra. Once it finished, there wasn't anything else. There was no more funding from the NHS. So I actually think social care has got a real something definite to offer in terms of crisis, in terms of not seeing crisis as something about just taking medication, but actually something which is helping the sort of people to live their lives in a much more holistic way. We know that when people go into crisis, it can be about the post piling up. It can be about the fact that they've not got any heating and the fridge doesn't work anymore, or something else has gone wrong in their lives. They don't have anywhere to live. And I think if we can resolve those points or support people with it, we are much more likely to be moving people towards having better lives and the sorts of lives they would want.
Okay, thank you, Claire. Now I can see that we're doing really well for time, actually. I'm sort of quietly impressed that we've managed to keep to time so well. So I think if we take a couple more questions, I think we could possibly finish 5 minutes early and just allow people time to get away. Really appreciate people making time to join us today. But Gavin, are there any other particular themes that we've not already covered that have been mentioned in the chat?
Yeah, so we've got, as I said, a lot of comments here, but there's something about a co-production. I think someone was talking about that actually that they felt it's not happening enough. And as it's not really a question, more of a comment, but I suppose it's something to put to the panel.
Okay, Melanie, do you have any thoughts around co-production?
Yeah, it's certainly something that ADAS promotes, but I think it's recognising that there's huge variation across the piece. And I think as Mark and Claire and possibly Steve have reflected, we've got different degrees of integration across the piece as well. So Nottinghamshire, for example, the social work for mental health is completely within the department, where other places it's completely integrated in the trust. And I think that influences some of the culture of co-production. So whilst I think we all recognise that it's a good thing, and nobody would stand up, would they, and say, oh no, it's a really terrible thing, it doesn't bring better outcomes. I mean, we all recognise it does. I think there's a reality about the difference in the practice, and it isn't something, unfortunately, we can force, is it? So, you know, you can't put it onto an improvement programme and say you must do it, because it has to come, I think, from the heart and the culture and be part of the way in which we operate as social care, social workers and AMP. So I think that's all I can say on it, really. But yes, I agree, there should be more. We don't do enough of it, and we don't do it well enough.
Yeah. Yeah, perhaps aspiring to be more meaningful and purposeful in the way that we do that. Thank you. Emad, any observations or comments you would like to make around co-production?
Least restrictive alternatives to admission. I think we need a dedicated session for that. I really slightly, if I may, want to change the topic. Mark earlier had the privilege to do that. So really about the AMP workforce is our most important resource. So please, can I share with you the following helpful pointers in relation to addressing the impact of COVID. I have been asked by BAME AMS to raise for their employers, the local authorities, to take action on the following: to prioritise high-risk staff, which includes BAME AMS, for testing and antibody testing and vaccine if and when available. It's really important. In fact, one of the AMS did call me during the tea break and really urged me to raise that, and to develop a culture where all the staff feel empowered to speak out, and very important given the unfortunate rise of racism and discrimination, that we need to tackle that, and whenever it occurs in the workplace. It's important now, and maybe more than ever before, to look after our workforce. They are under immense pressure, doing a fantastic job. So please, I'm glad Melanie here from ADAS to ensure that message is conveyed across local authorities. So this is really from me, and it's been a fantastic event. And please convey the message to the workforce. Anybody who would like to join the BME AMP forum, to send me an email. And it's been a very active forum, very beneficial, a lot of exciting, helpful, very positive contributions and fantastic ideas for the future. So thank you. That's from me.
Okay, thank you very much, Emad. Right, I think as far as this event is concerned, I think we'll bring things to a close. I'd like to thank everybody for joining us today for the last couple of hours. I hope you found it interesting and useful and informative. Thanks to all the AMPs out there for all your hard work this year and beyond. I'd like to thank our panelists, so Steve Chamberlain for the survey and report in of itself. Thank you very much. Claire Barcham, who is the chair of our mental health group here at BASW, Mark Trewin from the Office of the Chief Social Workers, DHSC, Emad Lilo from the BME AMPS group network, and Melanie Brooks from ADAS. Thanks again for joining us today, and stay safe and speak soon. Bye-bye.